Just a few months back, my father was critically ill. Along with the grief and sadness of a parent being unwell, a lot of my own fears came up. My own fear of illness. Number of questions flooded my mind. But the main question was, will I have the ability to do what I need to do when I need to do it? To break this down further, will I have the right doctor, the right hospital at the right time? Number two, will I have the financial ability to afford the treatment and the care that I need? Welcome to Heart of Money with Soumya. I'm Soumya Panda, an investment advisor since the last 20 years, and now bringing to you conversations around money that make it a taboo topic. Today we explore how money brings up emotions of fear about the future, specifically when it comes to health and illness. Today we're chatting with Nilanjan Roy, Head of Business, Manipal Cigna, a global Indian insurance health company. Nilanjan has 15 years of experience specifically in the health insurance space. Today he joins us to share his insights backed by his experience in health and wellness. Thank you so much, Nilanjan, for agreeing to come and have this chat with me. I'm going to start with my first question. You're in this health and wellness space, so you're constantly talking about illness and sickness. How does that feel?
Well, first of all, thank you so much for having me here. It's a pleasure to be talking about this important topic about health risk management. Coming to your question, yes, health, illness, wellness, these are extremely important topics that we deal with in our industry because it's primarily to do with how we predict and how do we analyze an individual's health and look at the propensity of that person falling ill sometime during his lifetime and what can be the financial implication and creating some kind of a financial management around it, and that's what basically helps us develop products that we sell in the market. So yes, it is important, but I also believe it's very, very pertinent that we talk about health, illness and wellness. It's definitely very different than working for maybe a tobacco company and talking about the ill effects of tobacco. Here it is very different. Here is risk mitigation aspect that becomes more important. So when we think about illness, when we think about wellness, we are actually thinking about you, or basically our consumers, our members, that what will create a situation where they feel that they are completely in a financial mess. How do we protect that? How do we give them that peace of mind? So in a good way, we are thinking about health.
I'm noticing as years are going by, this whole fear around sickness, illness, health, how baseless is this fear of mine?
It's not baseless. It's absolutely one of the truths of life. One truth of life is you are born and you are going to die. The other truth of life is that you will continue to grow older. And at some point, maybe there will be some health episode which will happen. Right? So these are ultimate truths that we have to really kind of align ourselves to. So from that perspective, having that fear is good. It's a pertinent, it's definitely something that's important to have in everybody's thought process. Okay, so it is not about just thinking that life is all about great things happening. Of course it is. But it's also about ensuring that you are not exposing yourself to a situation which can completely destroy what you have built in your lifetime just because of something that could have been managed
that you didn't give enough thought.
Yes.
According to you, what are the quick fixes to this fear? What are the ways to manage the worry and anxiety around your own illness and sickness?
So I think the first and foremost thing that everybody should invest in when we talk about health risk mitigation is adopting a healthy lifestyle. That's very, very important, right? Because health is something that can be managed. Okay, so you can improve your health risk scores if you manage it. For example, if you have a propensity to obesity, so you should have good eating habits. You should exercise, in a particular duration per week, per day. The second is to understand and believe that in spite of all of this, things can go wrong. And when things go wrong, what is going to be the financial implication of managing it? how do I manage that expense if after everything, if something goes wrong, when is it going to happen, the probability around it, and when it happens, what is going to be the financial implication, and what should I do to manage it? And that's where you start thinking that, okay, how do I insure that risk, right? So that is where the concept of insurance comes in. And the third aspect which becomes important when you think about managing this is, when you know how you have to manage it, it is also understanding that how would you want to manage it. Is it like just management for the sake of management? Like, for example, if you had a serious health episode, are you going to just go to something that is in your close neighborhood, or you want to access the best that the world has to offer? So there are a lot of other things that will go into thinking about that, and that's where consultative advice becomes important. So these are basically the three things: healthy lifestyle choice. Second is understanding, in spite of all this, there is going to be a risk that will stay. How do you manage it? And when you have already thought about managing it, how to manage it. We don't expect, let's say, you to be thinking about health insurance every day. I do it because it's my business. But somewhere, what I specialize on and what you are thinking of has to kind of align, and that, I think, is the concept of the insurance advisory.
So you spoke about leading a healthy life, you spoke about managing the risk, which is inevitable, and the third is to get the right advice. Having said that, every year we are watching the cost of healthcare going up. Everything is so commercialized, and it's one also finds it difficult to trust where this is headed. What do you have to say about that?
So we all understand economic inflation, right? So economic inflation is basically what costs X today, probably tomorrow is 2x, 3x as the years go by. Similarly, in healthcare, there is a concept of healthcare trend, or what we call as medical inflation. So if we only talk about India, medical inflation today is averaging at 15 to 22%.
That high?
Yes, it is very high. So it is almost more than double of economic inflation. So if economic inflation averages at around 7 to 8%, here we are talking about 15 to 20% or higher. So which essentially means what? It means that medical inflation is growing more than double of what your income levels are growing every year.
Clearly.
So which means every year it is becoming doubly more expensive to manage your health. Not that you're falling ill every year, but just imagine if you are, let's say, somebody who's a 25-year-old just starting his career or her career. If he's thinking or she's thinking about her, the health risk, they are thinking that probably around the time they're 50, 60, that is when they will have probably a health episode. So which is maybe 20, 25 years down the line.
Yeah, it's far away.
Yes. So 15, 20% per year compounded in 20, 25 years is a very, very big amount.
Yeah, it almost seems like a lost cause. Like, jo hoga dekha jayega, Bhagwan pe chhod do.
Correct. So medical inflation is something that is a reality. Today, when we think about health insurance, we hear plans which are 2 lakhs, 5 lakhs, 6 lakhs, 10 lakhs. Is that enough?
So people feel very happy, हाँ 10 lakh का health insurance है मेरे पास.
Yes. So you do understand that talking less and saying that I'm insured does not solve the long-term issue of real health risk management, which is a byproduct of how health inflation is growing. And what is health inflation? It's not just that hospitals are charging you more. It's about new technologies, correct? It's about a drug that wasn't there, and the drug comes in, and the drug comes with a lot of research. So there is a cost of that research which has to be collected back. So this is reality. It will continue to happen. What is also happening is, because of medical advancement, people, when they're becoming patients, they want the best to be available. So being aware that when you're making a choice of health insurance, you're actually having to solve two issues. One is your long-term health risk mitigation, which is from a cost perspective. And the second is an immediate thing, which is something that can happen in the foreseeable near future. Maybe an accident, maybe an epidemic because of which somebody got ill. What is the cost of that healthcare versus what is the cost of long-term healthcare? So medical inflation is very, very important, pertinent, that has to be kept in mind. At the same time, you also have to understand that as a person choosing health insurance, you cannot cover the biggest risk that is lying out there, because it's a question of affordability also. You want more sum insured, which is in insurance, you have to pay more.
Yeah.
Now, when you're going to a 25-year-old and saying that, okay, you actually need maybe 2 crores or 3 crores or 10 crores when you actually are going to fall ill 25 years later, he's not going to have that kind of money to pay for that kind of insurance, right?
Yeah.
So there has to be some logic, right? And that logic basically again is, open to different kinds of interpretation. But the thumb rule always is that you should at least have 2 times your current annual CTC or your annual earning as your basic level of health insurance, right? So if somebody is earning 10 lakh rupees, should essentially have 15 to 20 lakhs as the sum insured.
My next question to you is, the perception is that if something costs more, it means that the quality is better, especially in healthcare. What do you have to say about that?
Not always true. If you really look, within India, there are some centers of excellence, medical care centers of excellence, who don't charge even a single penny, but they are probably one of the best hospitals or healthcare centers in India. So it is not always, that if you pay more, you're going to get the best. In some cases, it is true that if you did have something that is extremely critical, not because the hospital is charging you more or the doctor is charging you more, it is because access to medical technology that would manage that kind of a healthcare need is actually going to cost money. Okay, so because of which, the cost is higher, but not necessarily that, you have fever and you went to the nearest supercritical center, your fever is going to go off in one day. If it's a viral fever, it's going to stay with you for the next couple of days, right? You can't do much about it. So it's a matter of choice. I think in our country, we have kind of glamorized healthcare. It's only in India that you have different levels of rooms, room categories in hospitals.
Suites and double suites. And
they can give a 5-star hotel a run for their money, right? So they have more categories in the hospital than
as far as rooms are concerned.
Yes. Yeah. And you know what's the bad part? The bad part is the total cost of healthcare in that particular center actually varies with the choice of room.
Yeah.
So that same doctor, the same equipment, the same nurse servicing a patient in a luxury suite is going to cost 10 times more than that same doctor going to the general ward or a twin sharing ward and taking care of that patient there.
Yeah, you're right.
Maybe an additional smile is all that you will get extra from the doctor.
Better air conditioning. But in India, things have really changed. I mean, in terms of the kind of medical facilities, treatment, care, doctor, technology that we have. Would you agree?
So definitely yes. So our level of healthcare has gone up not only a few notches but many notches ahead. But again, the question comes that how many centers of excellence we have created in the last so many years, which are considered to be at global standards. That is where I think India has to do a lot of work, and that is where again a lot of Indians who can afford, they actually end up going abroad for treatments because they want the best. But then we also have situations where a lot of patients from developing countries or poorer economies are actually coming into India because
I have noticed a lot of NRIs find it far more convenient to now come into India, get their treatment done and leave. So both from the cost and quality point of view, they find it better here, and even the post-op care that they get, they feel that it's better here.
Yes, it is definitely much better here in India because one, we are able to offer the same quality of medical technology that the developed world also has access to. At the same time, there is also that population which I just spoke about, which are basically
that feels the need to go abroad for treatment.
Yes, which is basically the global center of excellence, like somebody going into one of the top US hospitals for a cancer treatment. We have to be very, very open to that kind of a reality also, because healthcare has to be truly global. So I should have a choice of getting myself treated wherever I want, depending on what I believe is the level of care I need. And secondly, when we talk about managing risk, health risk, this is also a very important thought process. That is it aligned to my thought process around how I want to access healthcare?
So how I want to access healthcare for myself.
Exactly.
So clearly this is a part of self-love and self-care.
Of course, of course.
So for someone who's just beginning to explore this whole topic of what is the right way of going about my healthcare in future, how should they approach it?
So we have this three-pronged, approach where we start off with the concept, which is basically ensuring that the need is understood well. And when we talk about need, we say health insurance zaruri hai, right? So that is the first basic understanding that every person should have, and then it's a step-by-step process. So the first process is assessment. Assessment is what? Assessment of where you are in your life. Second assessment is what is your earning level. Third assessment is what is your family background.
Family background in health or?
Not health, it is, how many individuals you have in your family, right?
Okay.
Are you talking only about you, your wife, or your husband and children? Or are you also talking about elderly parents who are with you, who are dependent on you, right? So understanding that entire concept. Third is when something does go wrong, where are you going to access healthcare? So for example, somebody living in a Mumbai or a Delhi will access healthcare in these cities, which are definitely more expensive than some of the other tier B, tier C towns and cities of India.
Yeah.
And once you've made all these choices, then basically it is about going out and trying to find out who are the insurance companies who are offering different kinds of health insurance products. So there you need to get access to certain product comparatives, right? That is exactly the stage where you start talking to an advisor or a consultant or an insurance agent, and then trying to basically get more information around what kind of products are available, what kind of coverages are there, what should be the basic minimum coverages you should have, what are those good to have frills, right? I mean, looking at it, it's like buying a car. I want to have a car which has got everything that any modern car offers. But the question is, when I buy such a car or when I buy such an insurance product with so much frills, I'm going to pay more. How many of those frills are necessary frills to have? How many can be kept aside? Because the concept of health insurance is every year you can make tangible changes to your policy if you want. Yes, that is allowed. So that's the second thing. So trying to figure out the products in the market. So the third point is basically where you've made a choice of the products. Typically you should choose between 3 to 4 products before you make a final evaluation, which is going to be the product and the insurance company that you want to buy the product from. So that is where you start basically evaluating the insurance company. What is their claims payout ratios, which at least gives you an idea that if something was to go wrong and you need to access the product, will you get all your claims paid? Because that is a big question on every health insurance customer's mind is, I don't read the fine print or I don't understand the fine print. There is so much of fine print. Will I ever get paid? Will I get my claim when I actually file for a reimbursement or for in a cashless scenario? And then, of course, you need to definitely read the fine print. If you can't read the fine print, ask the advisor to explain each and everything, correct? You have to go through that exercise and then you choose the insurance product. Thumb rules, 2 times of what is your net annual income. That's the basic level of insurance that you should choose, and it keeps going up with your income. Of course, it changes a bit if you were to basically think about an insurance that gives you coverage not only in India but globally. Then probably the thumb rule changes a bit, maybe 3 times or 4 times. But at a very basic level, if it's just India, 2 times is good to start with. Then of course the concept of medical inflation also has to be there. But again, slowly, you should start early, and slowly, gradually over the years, you can keep adding to the plan and making it richer. We have a golden rule in health insurance that if you have completed an 8-year cycle in your health insurance product, that is when you basically need to take your health insurance back into the service station for a service. So basically the entire healthcare market changes.
The system has changed.
Yes. So you need to update your health insurance.
Okay.
Because in 8 years, probably completely new set of products have come out in the market.
With new features and new frills and new benefits.
Yes, and the regulator allows portability of health insurance. So you can either migrate to plans, better plans within the same company, or you can port out your policy to any other insurance company that is offering some better product.
Shifting gears to personal situations, like some might be facing a situation where they have aging parents. And maybe as a family or parents, they never thought of health insurance before. Is there a way to kind of make good the gap of not having an insurance for all this while and now getting one for them?
Sure. I think we do have a lot of senior citizen plans that insurance companies sell. Like even my company, we do a senior citizen plan. These plans are typically a little more expensive.
Okay.
However, with time, with data being available, almost all insurance companies are able to offer more affordable senior citizen plans. So there are
without
plans.
too many deductions.
Without too many deductions. Of course, medical underwriting has been made a little more easier. So that if there are seniors who do not have extremely critical healthcare conditions that they're living with, they should be able to get a health insurance at a reasonable cost. I would also like to pinpoint that individuals who are salaried and working for companies which are offering parental insurance policy, I would strongly advise that individuals should subscribe to those parental insurance plans, because that is one very, very easy way to provide adequate health risk coverage for your senior parents.
So if someone has a health insurance already, what are the hygiene checks and balances that they should keep at all points in time? Like, how do they make the most of it while they have it?
Yeah, so I think the first and foremost what has to be checked, continuous basis, is the sum insured. So every year, with medical care costs rising, the sum insured that is there becomes inadequate even after the no claim bonus and all those things getting added back. So it is important to benchmark your sum insured with what should be the right sum insured. Number one. Number two, there are a lot of insurance companies, like you talk about us, we started this beautiful product a couple of years back called Lifetime Health, right? Where we said that, and we found out, it was our analysis that we did, and we found out that the cost of a 10 lakh sum insured insurance policy was almost similar, the risk pricing, to a 50 lakh sum insured policy. So we said that why do we have to push our customers to buy a 10 lakh product? Why can't they buy a 50 lakh sum insured product which offers a much greater protection at probably a trifle more than what they would pay for a 10 lakh policy? Where is my risk? My risk is that first 10 lakhs. So why offer somebody 10 lakh and underwrite for 10 lakh and ask him to pay for 10 lakhs? Why can't I offer him 50 lakhs and price him for 10 lakhs?
So this is an evolution.
This is an evolution. So these are news plans. That is what I said, that every 8 years you need to do that, that cross check, that what is happening in the market which I am losing out. Is there something that is new? For example, historically all health insurance plans in India used to be inpatient cover only. It required you to follow the 24-hour hospitalization, or if it was stated as one of the daycare procedures, it was allowed. So there was no outpatient cover. So when we say health insurance that covers you in illness and wellness, wellness is when you are spending money to kind of ensure that your healthcare risk index is within what you believe should be, right? Which is like going to the diagnostic center once every year, once you're 40, to figure out that you are fine.
Yeah.
That costs money. So if your health insurance does not pay for that risk management, then it doesn't make sense. So right now, from last 2 years, especially after COVID, outpatient care or outpatient insurance is coming into vogue.
Oh.
So a lot of health insurance policies are now offering an ability for the insured member to buy top-up covers for outpatient insurance. So that is something that is new. So I would urge every person who has a health insurance policy to check with their insurance companies if they have a outpatient cover, or basically seek such kind of products from the open market.
Great. Thank you so much, Nilanjan, for this open chat. I think it was very enlightening, and what is most exciting is you've given literally like a rule book as to what one needs to follow to at least handle the fear around illness and sickness. Thank you very much.
It's been a pleasure, Soumya, and I do wish if anybody who's watching this, if you don't have health insurance yet, this is the time. It's never too late, because health insurance zaruri hai.
It's never too late. Thank you. Thanks a lot.
Thank you so much.
Thank you.